The second half of the Axial Skeleton Lab Study Slides YouTube is going to be on the hyoid bone in the neck, the vertebral column, including all the vertebrae, the sternum, and the ribs. We already covered in part 1 the skull. So let's start with the hyoid bone. We said that the hyoid bone is in the neck, and it's basically shaped like a horseshoe. It's smaller than the jaw, of course, and it's inferior to the jaw. So I want you to take, you can feel it on your own body, take your hands and hold it up to your jaw and just slide them down until you feel this in your neck. All right? Now when you feel that in your neck, thumb on each side of the jawbone, slide it down until you feel this horseshoe-like bone. Now keep your fingers there and swallow, and it should move up. That's your hyoid bone. It's a free-floating bone. It's not connected to any other bones. They have it wired in place here. It's for swallowing. There's all these swallowing muscles that's attached to it. Now it's a lot smaller than the mandible, so don't get it confused. See? Like a little tiny mandible shape, but it's a lot smaller. So that's it for the hyoid. Now we move to the vertebral column. Now, for the vertebral column, let's look at it from the back. Okay, turn this guy around. Now we can see here, we have 31 vertebrae. Now notice the plural is vertebrae. One is a vertebra. So altogether, the vertebrae make up the vertebral column. And we're going to have 7 in the neck. 1, 2, 3, 4, 5, 6, 7. C1 through C7, 7 cervical vertebrae. Then we're going to have 12 thoracic vertebrae, which are going to be connected to ribs. Now notice that the ribs are kind of small up the front, and they get bigger as you come down. So that would take us 12, T1 to T12 for the vertebrae. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. There. Now notice, we'll go over this again later, but notice how the ribs actually connect to the vertebrae here. And then in the lower back, we're going to have the lumbar vertebrae, 5 of them. 1, 2, 3, 4, 5. It looks like I counted that one, this last thoracic. So it's 1, 2, 3, 4, 5. And then we come to the sacrum, which is actually 5 fused vertebrae that connects the 2 pelvic bones. And then we even have a coccyx tailbone. That's 2 or 3 vertebrae fused together there, the coccyx. And there's going to be nerves coming out between all these vertebrae. The nerves would be coming out between them here. Let's look at our sheet and see where we are. Okay, so we have the vertebral column, and first I'm going to go over the parts of a typical vertebra. All right, we have a typical vertebra here. Now this is looking straight down on it. All right, straight down. And what we're going to see is 5 basic parts of this vertebra. We know that the bulk of it, this round part, is the body of the vertebra. That's anterior. And then sticking out posterior and along our back, we can feel these, would be the spinous processes. Sticking laterally, we have 2 transverse processes. The hole in the middle is for the spinal cord, and that's called the vertebral foramen. Remember, foramen means hole. The 5th part we'll see is some smooth areas on the vertebra where other bones articulate. So that's going to be called a facet. There's one there and one here where the next vertebra up connects with it. You can see how we have two connected here. And this is a smooth facet right here. And the smoothest means there's cartilage there connecting it to another bone. So if I take this off, we can see the facet here that would be connected to another bone. Okay, so all vertebrae have those 5 parts. Let's look at it on a full skeleton here for a minute. So you can see from the side here, I'll try to get this angle. Like this is a vertebra here. This would be the body, the round part you saw, and sticking out on the back is the spinous process. To see the lateral process, transverse processes, we have to see it from the back. There's a transverse. You can't really see the vertebral foramen because it's between the body and the spinous process. I can't see the facets because they're covered by the connections to the bone, but a facet would be right in here. All right? Let's look down here in the lumbar area. Body, spinous process, body, spinous process, transverse process. Now, we can see where this metal bar goes, that would be where the spinal column would go, and that would be the vertebral foramen. Now, in between the vertebrae, we have some structures, intervertebral parts. We have a disc between the vertebrae. We have a foramen between the vertebrae. We have spinal nerves coming out between the vertebrae. Again, let's look at the real skeleton. Well, the full skeleton. Here, from the front, you can see the intervertebral disc. Now that's made of cartilage, and they show it as usually rubber on these models. And that's a disc between the vertebrae because inter, I-N-T-E-R, means between. If you hear about somebody getting a herniated disc, that's what it is. Some of that disc will protrude out here and maybe pinch the spinal cord or spinal nerves. Now, the intervertebral foramen can only see it when you have vertebrae together. This would be the intervertebral foramen. And nerves would be coming off the spinal cord there. So let this metal bar simulate the spinal cord, and a wire coming out would simulate a spinal nerve, intervertebral foramen. And then the other part between there would be the spinal nerve that we already mentioned. So let's just look at this model for a minute so you get this down. 2 vertebrae here. Body, one, body of another. Spinous process. Spinous processes always point down. This would be the intervertebral disc. This would be the intervertebral foramen with the spinal nerve coming out the intervertebral foramen. Of course, going down the center of the vertebral foramen is the spinal cord. Let's look at these 2 vertebrae. All right, now, if you have a single vertebrae, you don't see the intervertebral foramen. You just see a notch here. So you have to take a notch there and a notch on the one below it and put them together, and you have the foramen. See? There's your foramen. 2 notches together. There's a notch on the top one. There's a notch on the bottom one. Put them together. You have the intervertebral foramen. Okay, now let's turn your page, and we're going to look at the types of vertebrae. Because remember, we said basically, let's move some of this stuff out of the way. Basically, you're going to have 3 types of vertebrae, and we're going to have a sacrum. So if we looked at the 4 there, And we're going to distinguish between these main three first. We have here let's put them in this order here, cervical vertebra, thoracic vertebra, and a lumbar vertebra. Now, to distinguish them, we can look at the three main features: the body, the spinous process, and the transverse processes. Now, obviously, when you look at these, you can see that they get bigger. Flip this one over. The body gets bigger as you move down, lower and lower. Cervical, small body. Thoracic vertebrae, medium body, usually heart-shaped. Heart's in the thorax. And then a big body for the lumbar. And that's because the lumbar, it takes the full weight of your body. It needs to be bigger and stronger. Now, we also can look at the spinous processes. Now, the spinous process is going to point down. Let's look at it from the lateral view. Okay? Now, the spinous process is kind of short in the cervical. And the other feature of the spinous process on the cervical is it's bifurcated, which means it has a notch that looks like two extensions there. Furcated means it's indented. The spinous process of the thoracic is long, and then the spinous process of the lumbar is just wide and blunt. Thicker, just like the body, all right? Now, when you get like C1, C2, you can see this classic spinous process of the cervical, the bifurcation. But as you get to C7, right before you get to T1, the spinous process almost looks like a thoracic. So we're going to have one more criteria to distinguish these vertebrae. And it's going to be the transverse processes. Okay? So now, transverse processes in the cervical are going to be shorter, but they're going to have a foramen in them. See that foramen in the transverse process? It's called a transverse foramen. And what runs down there is a artery, a vertebral artery, running up to the posterior of your brain, supplying it with oxygen and nutrients, only in the cervical. In the thoracics, we have transverse processes. They're kind of long, but they're going to have an indentation on them for the ribs. I'm going to pull this one over here because it shows it a little bit better than that one. Okay, so here we go. You can see in this transverse process, this indentation here and here should be smooth and indented. It's called a costal facet. Costal means rib. And only the transverse processes have those. On this side, you can see a nice costal facet here and another one here. The rib's going to kind of curve around like that. And then on the lumbar, short, blunt, transverse processes. Now let me show you on the full skeleton here. So you can see C1 through C7. As we get to 7, it almost looks like a T1. See how the spinous process is 1, 2, 3, 4, 5, 6, 7. C7 is starting to look like T1, but look at this. C7 has a transverse foramen for the vertebral artery, but T1 does not. Now that model here, when we cover blood vessels, you will see that this is the vertebral foramen running through those holes, foramen in the transverse processes. All right, now it starts in the neck area, so it's no need for that to run down through the thoracic vertebrae, so they don't have a foramen. In case you're wondering what this is the carotid artery supplying the anterior part of the brain. If we look at the back here again, see how I mentioned before how the spinous process always points down. So you know you're holding the thoracic vertebrae correctly if the spinous process is pointing down. And even on the lumbar, it points down a little bit there. Remember how I mentioned again, how the ribs connect to the thoracic vertebrae right here and right there. So that's where the facets are going to be. There on the transverse process of the thoracic vertebra and on the body there. Okay? They connect about where those screws are there. See if I can get this in here without, I can't reach that far, it doesn't look like, but maybe. So you have one there into the body. Try this one. And there would be to the transverse process, there and there, facets. Now, if you want to have one criteria to go by between the body, spinous process, and transverse process is the most important thing. Another way people use sometimes is what creature does it look like? So, to the side here, they say that the lumbar from the side looks like a moose. Moose are big, right? And then the thoracic looks like a giraffe. There's the spinous process pointing down. There's the giraffe. And then the cervical look more like a calf, maybe an anteater. But any way you can use to tell the difference. And of course, the sacrum. You should be able to tell that pretty easily. Now notice the sacrum. I do have some parts of the sacrum. The median, this is from the posterior, the median sacral crest is where some of the spinous process of those fused vertebrae just sort of made an indented crest. And then you have the sacral foramen, would be like the intervertebral foramen. And then we have the sacroiliac joint, would be the rough sides of the sacrum, because remember, that's wedged between the hips. So you see here, the sacroiliac joint of the hip is right there. This you can see how the last two lumbar vertebrae kind of blend in and join that nice sacrum there. And then we have the coccyx tailbone right there. Okay, now you noticed, move all this stuff out of the way, you notice that in the cervical vertebrae, kind of skipped over it, we have two specially shaped vertebrae, C1 and C2, the atlas and the axis. Now they're shaped, and let me just show you those to you real quick here before we move to the skeleton. C1 is shaped like a ring. Now let's bring the typical cervical there as well. So this is your typical cervical. Let's put it like that. Okay. So, you know, the body of the typical cervical there. Well, we don't have a body on C1, which is kind of a ring. C2, we do have a body, and we're going to have an extension here that looks like a tooth. So that's going to be called the dens. The dens of C2. Dens, dental. Some people call it the odontoid process. Irregardless, odontoid or dens both mean tooth. Dentist, tooth. Odontoid, tooth. Dens, tooth. Now, what some people think is that that extension, which is going to be important, used to be the body of C1. Instead, it's fused to C2. I'll show you how that's going to be important in a minute. So we don't have much of a body in C1. We have a body on C2, the axis, but it's an extension on that body called the dens. Now, as far as the spinous processes, we had our typical one here with the bifurcation. We don't have much of a spinous process here in C1, the atlas. Get a little bit longer in C2 here, the axis. We still have the transverse processes. There's your typical transverse process with the transverse foramen. C1 has them, and C2 has them. Now, what these do, this is how they fit together from the top. Now, first of all, on C1, the skull is going to fit. So these little big indentations here, if you remember the occipital condyles of the skull, they fit right into these condyles here. Let's see if we named them at all. No, we just calling them facets. So they're kind of deep there on this side where the skull fits in. Now I have a skull here. And if we look here, the upper side, you see that? Let's see if we can get it here. Trying to get the right angle. All right. We have these extensions of the occipital bone, occipital condyles, and they're going to fit right on these facets here. So let's see if we can get it to fit. Okay, so it's going to kind of go like that. I have to pull that up. Let's look at the real one, full body, and see if we can see it. Okay, there we go. So we have the occipital condyles here, and they're going to fit into those depressions on the atlas. Now, it's called the atlas because in Greek mythology, I believe it's Greek, they have a picture of Atlas holding up the world in his hand. So since the atlas, C1, holds up the skull, that's how it got its name. Now this relationship again, from the side and the front, we can see that dens sticks up into, the dens of C2 sticks up into C1. Now what that's going to allow us to do is move our head left and right. Let's look down on this a minute. Okay, so this rotates like that, like this. I can try to do it with one hand. Rotate, move our head right, move our head left. So it's called the no connection there. C2 allows us to say no, left and right, because that dens. There's actually a ligament going across here, holding that dens against the anterior of C1. Now what allows us to nod our head is that C1 connection with the skull. So this would go up and down. The S vertebrae would be C1. Let's see if we can get it on here. I pulled the condyle out of C1 there, but can't really do it there, but we can go right and left. C2, up and down, yes, is C1. I don't know if any of these other ones can do it better. Not really. But you get the idea. Hopefully you do. Yeah, pretty tight there. Anyway, get this connection down. Let me show you with the ones I had here earlier. So this would be C2, the axis. You should recognize it by the dens. Okay? And now if I take C1 and I put it on top of it, there, that's how it connects. So picture the skull on there, and this could go like this for yes, and then rotating for no due to the C2. One more time from the top. Really a neat connection there. Okay, let's go to the sternum. Get my sheet here. Now on the sternum, back this way. Thank you. Let's move you a little bit more, okay? Okay, that's good. So the sternum, we actually have three parts of the sternum. Remember I said it's also called the breastplate. We have this part up here called the manubrium. Make sure your sheet's in front of you. Then we have this part called the body. And then we have this part called the xiphoid process. Manubrium, kind of like the bow tie part. Body. And the xiphoid process. The manubrium has the clavicle connected to it and a couple of the upper ribs. Body has a lot of the mid ribs there. Xiphoid process doesn't really have a connection to other bones besides connected to the body of the sternum. This is actually flexible, and this is a landmark. When you go to do CPR, you're supposed to run your fingers down the sternum until you feel this little protrusion, which is flexible, and you can kind of push on it a little bit. And then from there, you take your other two fingers and put them here, and you would start your palm right there. Let's see if we have a mannequin here. And this one shows the sternum here. So you run your fingers down and take it on yourself and just run it down the body until you get to this little xiphoid process, which actually sticks a little bit out anteriorly. You can push in on that a little bit. It's right there. Two fingers there. Then move two fingers up from there. Then put your palm right there, and you're right around the heart, bulk of the heart area right there. Important landmark, the xiphoid process. Here's a model of this with the ribs attached. Manubrium, body, xiphoid process. Now getting to the ribs, first of all, let me point out that the rib bones are connected to the sternum by cartilage, okay? So that part here, the rubber part, indicates cartilage on the models. So it's not bone to bone here, it's cartilage. Now, why is it cartilage? Well, we want it to be flexible because remember our lungs are protected in here and they need to expand. So we need these ribs to be able to expand. Not only when our lungs fill up, but there's going to be muscles between here that contract and dilate and expand the ribs and close the ribs. There's going to be a diaphragm down here. It's going to help us breathe as well. So the rib cage needs to be flexible. That's why we have cartilage, but it also needs to be protective, and that's why we have the bone part. Now we have 12 ribs. The top two people don't realize are pretty small here. Very small. Then they get bigger as you come down. Let's count them. Should be 12. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. All right, 12 pairs, making 24. Now on your list, you notice that we indicate the posterior part and the anterior part. I'll show you with a separate rib here in a minute, but notice that the posterior part, let's come around the back. I'm gonna knock things over here. Notice in the back we have a sharp curve where it comes around to meet the vertebrae in the back. Very sharp curve. And then as you get to the front, there's a broad curve. So where it's broad is going to be the anterior part. And then you'll see a little notch in here where the cartilage is connected on the anterior as well. Then you're going to have what's called true ribs and false ribs. Now on your sheet, it says we have 7 true ribs and 5 false ribs. Look at this part here. True ribs 1 to 7, false ribs 8 to 12. And then we're going to have floating ribs 11 to 12. But I'll point out here that floating ribs are false ribs. Let's look at it. True ribs have to have cartilage that connects directly to the sternum. False ribs have cartilage that connects to cartilage of the true ribs. Let me show you what I mean. This is a true rib. It has its own cartilage going to the sternum. There, 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 and there. Now 8, 9, 10, 11, 12, they have cartilage, but it joins the cartilage of rib 7. So they're called false ribs. And then the floating ribs are actually floating. They don't connect to the sternum. 11, 12. Now the definition of false ribs is they don't have their own cartilage. Well, they don't have any cartilage at all. So they're still false ribs. Let's do it one more time. 7 true ribs. 1, 2, 3, 4, 5, 6, 7. 8, 9, 10, 11, 12 are false ribs. 8, 9, 10, 11, 12. 2 of them are floating, as you can see. And this cartilage here, costal cartilage. Costal means rib. Now let's take a bag of, here's the ones here on this model. 1, 2, 3, 4, 5, 6, 7. Let's dump a bag of ribs out, okay? Okay, whole bunch of them in there. Well, that's the top one. There. The other ones start to look more like ribs. Now see how I'm putting it here? Which end's posterior? The sharp curve. Because here it curves to meet the vertebrae, right there. The broad swing out is anterior, and if you notice on the anterior, it has a little notch here where the cartilage fits in. If we look at the posterior, we'll see a couple little extensions here. Probably touches the vertebrae there and there. Now if you want to know what area is the inferior is sharp. Pretty sharp there. So this one here would probably go, I know this is inferior, I know that's posterior. So that's going to go on the body kind of like this. Okay? Let's pick another one. Another posterior. Now you're saying, how do you know if it's that or like that? Well, I'm not going to ask you that first of all, but I know the sharp edge is inferior. So this is also going to be on the left side. And I know this little part fits down, this little extension here. But you just need to be able to tell anterior from posterior. Trying to find one. Looks like this is the left side. Notches facing down, sharp curve towards the posterior. Anterior has this little indentation for a cartilage, sharp on the inferior. So that's going to go more like that. Right there. All right, I think that pretty much does it for the rest of the axial bones. A lot of guys back here. We'll have a meeting later, guys, probably about 5 o'clock.